Hello everyone, welcome back to my channel. Thank you to my returning subscribers, and if you are new here, I'm Mesoman Nabrini and I discuss everything health. Today I'll be talking about family planning and its various methods. So what is family planning? Family planning is defined as the voluntary process whereby an individual or couple determines the timing, space, and frequency of the pregnancy with varieties of conception prevention methods. And also, you need to note that sex selection is also part of family planning because when you get the exact sex distribution you want, it prevents you from trying to get pregnant frequently just to get the sex you want. But for the context of this video, I'll be talking strictly on contraceptive method. Okay, I'll make a video on sex selection in my next video or any subsequent video. So this leads us to the types of family planning methods. We have the natural methods, the traditional method, the modern method, which is also known as the artificial method. So let's look at the natural method. So in this natural method, the woman needs to monitor and record the length of her cycle for at least 6 months. It can be referred to as the calendar method where you chart your menstrual cycle. Okay, then you have absence from sex, that's abstinent from sex. Then cervical mucus observation or monitoring, which is also known as the Billings method. So this method is based on the observation of the mucus pattern. By recognizing the changes in your cervical mucus, you can pinpoint when your ovulation is approaching. Okay, so this cervical mucus or the Billings method, it comes in phase. You have the dry phase, which occurs 0 to 3 days after your menses. Okay, so during that phase, there's literally no menses, your cervix is dry. Okay, then after that, you have the cloudy and sticky phase, which ranges from 4 to 6 days after your menses. So in this phase, you have a secretion, that's the mucus coming out. It's cloudy, kind of yellowish, and is sticky. Okay, then after that, you have the creamy phase. So the secretions you get during this phase is creamy in nature, which ranges from 7 to 9 days after your previous menses. Then you now have the wet phase. So this wet phase, the secretion you get during this phase is slimy and also sticky, and this is what we refer to as egg white. So when you touch the mucus, it's stretchy. It can stretch up to 3 centimeter or so. Okay, so during this phase, it is said to you're in your fertile phase, almost approaching your ovulation or even in your ovulation day. So you need to know your cervical mucus state. Okay, then that leads us to the basal body temperature. So this has to do with you checking your temperature. For this method, you need to record your temperature every morning. If you note an increase in temperature, this is usually towards the ovulation period when you have an increase in the luteinizing hormone. Please, for you to be able to understand this, you might need to go watch my video on the menstrual phase, that's menstrual cycle, when the hormones are high or not. So I'll drop a link on that in the description box. So this luteinizing hormone is usually on an increase around 24 hours before the ovulation or the ovulation day, and it tends to drop after the ovulation. So during this peak, you might notice your body temperature is high. But also note, this method is not really that reliable because there are several factors that can lead to an increase in temperature. Then we also have what we call symptothermal. So this method uses the body temperature, as discussed above, and the cervical mucus observation. So it's the combination of two things. Okay, then that leads us to the traditional method. So in the traditional method, you have the withdrawal, the lactational amenorrhea, and use of beads or other traditional items. So, in the withdrawal, as the name implies, withdrawal, that's taking off something, the man removes his penis from the woman's vagina and genital area before he ejaculates. Note the vagina and the genital area. So, basically, you will say, oh, he removed his penis from my vagina. But if he's still around the genital areas, maybe your vulva or close anywhere close to that, maybe your upper towel, my friend, note you can still get pregnant if he ejaculates around here. Because when he ejaculates around here, some stubborn sperms or active sperm tend to make their way into the cervix and you're likely going to get pregnant. So withdrawal is taking off the penis away from the vagina or anywhere close to the genital areas. Okay. Then the lactation and amenorrhea. You are likely to get prevented from pregnancy if you engage in exclusive breastfeeding. This is because the breastfeeding hormones stop the body from releasing eggs. So this lactation and amenorrhea is absence of menses due to lactation. That's the literal meaning, okay? And you get this when you engage in exclusive breastfeeding. Then we also have the use of beads or traditional items. Use of beads. Some traditional people who believe in tradition, says when they place bead during sex, it prevents them from getting pregnant. Or other traditional items, example, when they burn ash during lovemaking or having sex, it prevents the sperm from staying alive. That's the traditional method for you. That leads us to the modern method or the artificial method. So in the modern method, you have the barrier method, the hormonal method, the IUD method, that's intrauterine device. Then you have the sterilization. So I'll be looking at them one after the other. So in the barrier method, you have the male condom. We know what condom is. You have the female condom. That's usually longer than the male condom as well. Then you have the diaphragm. You know the condoms are familiar to us. So let me just discuss the diaphragm. So this diaphragm is also known as cervical caps. It's used by the ladies, okay? It's like a cap and it fits into the vagina, like you have to insert it into the vagina, thereby preventing the sperm from passing through the vagina to the cervix. And just note, before you insert this diaphragm or cap, you need to fill it 1/3 with what we call spermicide. Like it's a foam or gel-like spray or solution that kills the sperm, okay? So you basically spray it on the cap before inserting. But this diaphragm should be left for at least 6 hours after sex before you remove it. So this gives time for the spermicide to make all the sperms inactive and probably kill them before you remove, because if you remove them when the sperms are still alive, some might still stick to the sides and make their way. So literally you're preventing pregnancy, but it's not going to work if you don't abide by those rules, okay? So let's move over to the hormonal method. You have the contraceptive pills, you have the injectables, you have the patches and the implants. So these pills are tablets you take every day to prevent pregnancy. Injectables are injections. So these pills and injectable, they contain hormones called progesterone that stops the release of egg, and it also thickens the cervical mucus, making it difficult for the sperm to move through the cervix. The injectables can last 8 to 13 weeks depending on the one you took, and this is good for people who do not like taking tablets, okay? So let's talk about the patches. These patches are placed on the skin and it releases the hormone into the body through the skin to prevent pregnancy. Each patch lasts for 1 week and should be removed after 1 week. It is placed for 3 weeks. That's 1 patch per week for 3 weeks, okay? Then you do not make use of it when you are menstruating. Then that leads us to the implants. These are small flexible plastic rods that are placed under the skin in your upper arm. It releases the hormone progesterone into the bloodstream to prevent pregnancy. This can last for about 3 to 5 years depending on the type you chose. Okay. And please note, all the things under this hormonal method should be prescribed for you and probably done for you by your healthcare provider, because these implants you can't do them. Okay, so seek the advice of your health provider, either your obstetrician or gynecologist, please. Then that leads us to the intrauterine device. This device can be hormonal or non-hormonal. So these IUDs are T-shaped plastic device that is inserted through the vagina into the uterus, and it also extends to the fallopian tube, also known as the uterine tubes. Okay. For the hormonal ones, they release progesterone, which makes the cervical mucus thick for the sperm to pass through, and it also stops the sperm from getting to any egg that is being released. Then the non-hormonal, which is also called the copper IUD. This does not release any hormone, but the copper content of it damages the sperm and makes the environment hostile for them to survive, and also prevents the sperm from getting to the egg because it blocks the fallopian tube as well. Take note, the IUDs can last for 4 to 10 years depending on the type you chose. That leads us to another method called the sterilization or the permanent method. So you have the vasectomy, which is done in male, and the bilateral tubal ligation, in short BTL, which is done in ladies. So what is vasectomy? This is a surgical procedure where the vas deferens, that's the tube that carries sperm, is being sealed or cut off. Then the bilateral tubal ligation, which is done in ladies, it's a surgical procedure as well that involves the blocking of the fallopian tube. This prevents the eggs from being fertilized by the sperm. So once the fallopian tube is blocked, there's no way the sperm is going to get to the eggs. Okay. Then that leads us to the benefits of this family planning we've been talking about. So this is beneficial to the mother, the children, the family, and the nation. Okay. So let's look at the importance of family planning to the mother. So it reduces the number of maternal deaths. It gives her space to recover from the strain of the previous pregnancy, and it also gives her time for personal development. Then family planning reduces the incidence of unsafe abortion. Then it also protects her against unwanted pregnancy and STIs. Then what is the benefit to the children? It promotes better childhood nutrition, promotes physical growth and development as well. Then let's look at the benefit to the father as well. It allows him to keep balance in all aspects of his life. So when I mean all aspects of his life, that's the social, physical, mental well-being. Okay. Then also protects him against STIs. Then to the nation, it aids in population control. This is not where a family will have like 12 kids, 14 kids, 15 kids. It's not good for the nation as well. And it also promotes quality of life in the nation. Okay. Thank you very much for watching this video. Please don't forget to click the subscribe button, the notification bell to get notified on when next I post my next video. And please don't forget the like and share button as well. And also remember, the comment section is always open for you to pop in your questions, your concern, or any topic you want me to discuss. Thank you very much for watching this video once again, and see you in my next video. Bye bye.